The first step along your journey is to schedule an appointment with your surgeon. Here, the surgeon will decide whether or not you are a candidate for surgery and will discuss the need for medical clearance. This is also your first opportunity to ask any question or voice any concerns that you have about the surgery risks in the Joint Care Center process. Remember, it's your journey, and we're here to help you along the way. So always feel free to voice your opinion and ask questions.
The recovery isn't as bad as most people make it out to be.
One of the things I really liked about the staff at St. Joe was how open they were to addressing my insecurities and my concerns. Whether it's the nursing staff or the surgeons themselves, they'd be asking me, do you have questions? You know, we can't always tell what you're thinking. If you've got some insecurities or fears, we're here to address those for you prior to going for surgery. So that's what made me feel comfortable. I felt like every question that I wanted answered was answered before I went in.
So the surgery that I had like almost a year ago in February, it helped a whole lot. I mean, it was something I was nervous about, but I talked with the doctor and we talked a couple of days, and it was well worth it.
As far as pain level goes, before the surgery, on a scale of 1 to 10, with 10 being the most pain that I've ever had in my life, I would probably say that I was a 9.5. Maybe a 10. I never had more pain in my entire life, including elbow surgery, torn ligaments in my knees playing basketball, that I had with my hips. I would say immediately after the surgery, half the pain was immediately gone. Then I had a lot of soreness from the surgery, so I might have been a 5 after the surgery. And I'd say within a matter of a couple days, it was probably a 2, and within 90 days, I was a 0. I had no pain 90 days after surgery.
To have your coach there to learn the exercises with you is a plus, because you try to get slick and not do them right. You must do them right.
My coach attended all of the meetings. In fact, I think she was even talking to the doctors and nurses and exercise coordinators behind my back, because she wanted to make sure that she had all the information, because information is power, and she knew that the more knowledge she had, the better she'd be able to help me.
Your coach will play an integral part in your journey. A coach can be a spouse, a family member, a friend, someone you trust, and someone that has your best interests at heart. As you proceed through the Joint Care Center process, your coach will be by your side to help you understand the surgery, to lend moral support after your surgery and throughout the recovery process, and to get you home from the hospital. Beyond your coach and surgeon, there are several other team members involved that will play important roles in your surgery. Your patient navigator will guide you from your preoperative class and testing to your home care provider. Your nurse, physical and occupational therapist, and home care therapist are critical to your treatment and recovery. Everyone at St. Joe, from housekeeping and dietary to transport and anesthesiology, are here to help guide you through your journey. Before your surgery, you'll meet with your nurse and anesthesiologist in pre-admission testing. At this point, they'll perform a few tests and a physical exam. In addition, your nurse will also provide you with further pre-op instructions. Review your patient admission assessment, and of course, answer any questions that you may have.
Right knee, correct site, okay.
First going in to have the surgery, I was nervous. Thought I was going to change my mind about the surgery, but the pain was just too much for me to bear anymore, and I thought I could take pain.
I'd say don't be afraid. I mean, I can tell you, everybody goes through stages in their life when they have fear or they're insecure. I mean, and that's normal, I think. It's the fear of the unknown. But I can tell you this, you won't regret it.
Before your surgery, you'll attend a total joint replacement education class with your coach. Here, a nurse, therapist, social worker, and patient navigator will walk you through every step of the process: surgery, hospitalization, pain management, discharge and recovery, answering questions, and helping you understand the Joint Care Center process.
Prosthesis, it's going to be placed inside your knee or your hip.
While you were in the hospital and doing your therapy, they would give you the booklet with every exercise that you needed to do daily. I would advise you to do them. It's easier on you. You'll know exactly what you're going to do the first day after surgery. You're going into the room, exercise room, and you are going to do these exercises. And it just makes it a little easier to do.